unfortunately how long these exams do take, just due to what we have to do. So I'm just going to load up my cranial nerve sheet, just because that's what you're here for, obviously, which is, good, very good indeed. Okay, so I'm just going to introduce myself first of all. I am Dr. Williams, or you can call me Josh, just for short, but that's a little bit less professional, of course. But I'm a doctor here at Josh's clinic. I'm very talented at what I do, I believe, and we're going to get you checked out and make sure that you're nice and healthy, okay? So, I'm just going to briefly explain to you what the examination involves. It involves quite a few tests, just checking different nerves in your system and making sure everything's good to go. Okay, is that okay with you? Okay, so I'm just going to need to gain your consent. Good. And I'm going to ask you to sit down in that chair nice and comfortably. Are you comfortable? Comfortable. Okay, good. And I have to ask this, are you in any sort of pain, or have you done any sort of drugs recently? No, so nothing sort of like that. Okay, that's good. It's good to stay off those drugs. Okay, so we're just going to get straight into it. We're going to start with the olfactory nerve, because obviously everyone's got a life, so do I, and I would like to get out of here as quick as possible to go eat some of my Doritos. Okay then, so we'll start off with this. I'm just going to ask if you've had any changes in your smell, so let me grab my notebook once again and my pen. So have you had any changes in your sense of smell recently? No, unless it's like clogged up, like you have some sort of snot or mucus covering the nostril regions. But apart from that, you haven't had any change in your sense of smell. Okay, that's good to hear. Good. It's always good to get off to a good start. So I'm just going to move us down here, and we're going to move on to the optic nerve. And for this, there's quite a few things we can do, but I just start off with inspecting your pupils. I just want you to open your eyes as wide as you possibly could for me. Yeah, just like that. And I'm just going to be inspecting them, inspecting the size of them. They look quite good. Yeah, they look rather decent indeed. Oh, got a bit of pen on my chin. Okay. Yeah, it looks about good to me. Obviously I'm a qualified doctor, so I know what I'm talking about. Okay, so I'm just going to actually just do that, okay. So, I just want to assess the shape of them and the pupil symmetry. That may be quite weird to say to just a person who's not a doctor or in my sort of field, but I just need to look if there's anything wrong. I don't think there is, in my personal opinion. Obviously every doctor has got a slightly different opinion, but at the end of the day we all sort of match up. Okay. So I'm just going to stand you about 3 meters away from me, so yeah, that should do. And what we're going to do is I just want you to read some of the letters I'm going to write down here. Sort of like a Snellen chart test, but a little bit different. And if you successfully read out the letters, then your eyesight looks good. Some doctors are really weird around here. Okay, so I'm just going to write out some random letters. And I just want you to go ahead and tell me what these are. Okay, yeah, these are backwards for good reason. Okay, yeah, wonderful. Okay, so I was expecting you to get this all correct, so that's no surprise to me, really. Yeah, you definitely don't have poor vision, so we're just going to move on to the next step, where I'm just going to be testing your eyesight with a light, a LED light that I have here, a LED light. And what we're going to do, sorry my voice is going a little bit, my apologies indeed, but what we're going to do is I'm just going to turn off the main light here in the studio, turn on this little light, and I just want you to follow it with both of your eyes for me, okay? Okay. So let me just turn off the studio light, just like that. And just go ahead and follow this one for me. Yeah, from side to side. Oh, sorry. Okay. Looks good to me. Yeah. I'm just going to actually ask you to look through this Pacific little. It sort of makes just your pupil visible, and I just want to see that. Okay, so I'm just going to put that round your eye right there. Okay, and everything looks good. Okay, so that's good. How's your day been, by the way? Good. Okay, good. Good. Yeah, I should stop saying good. People do get annoyed with it, but it's all part of the job. Okay. Yeah, just give me a second. There's a lot of stuff they want us to do, but a lot of the stuff I just, pass off because it's a lot of rubbish, really. But here we go. I'm just going to be inspecting your eyelids for evidence of ptosis, which can be associated with, and I quote, oculomotor nerve pathology, Horner syndrome, or neuromuscular pathology. These are all sort of malfunctions in your eyesight / eyelids, which can cause infections in future. So we just got to check out your eyelids. So you don't mind if I get a little touchy again? Okay. Excuse me. Yeah, it looks good to me. Looks rather good indeed. Okay. The cover test, yes, this is what I've been meaning to. So I just want you to fixate on a target behind me. It could be this little ledge right there. Just fixate on that point for me, and I'm just going to cover one of your eyes with how about this little light changer? I'm just going to cover one of your eyes. Just fixate on that target for me, and then we'll try the other one. Okay. So. Okay. Yeah. Okay, good. And the other one for me. Okay. Also, I just want to go ahead and put these sunglasses on you. These sunglasses, and I just want you to tell me if these change your vision at all. Which worsens your vision, okay? So just put these on you. Okay. And do this change your vision? Okay. Okay, nothing out of the ordinary though. Okay, good. So that's all good. We're making great progress here. Because we're onto the trigeminal nerve. This trigeminal nerve actually has 3 subdivisions. I won't go over them. It's too much information, really, for just a normal non-doctor patient to know. But I just want to go ahead and but touch your forehead with my pen here, along with your cheek and your lower jaw. And I want you to tell me what sort of reaction you have, and that will tell me if your nerves are working to what they should be. Okay, so I'm just going to be poking you with the pen on the forehead. Okay. Okay, and now the cheeks, both of them. And the other one. Okay, and now the lower jawline. So just lift up a bit. Okay, just like that. And did you feel any sort of strange sensations there? Did your nerves react in a timely manner? Okay, they did. Okay, good. That's good to hear. A lot, as you get older, your nerves obviously slow down, to inspect your muscles here. It's called the motor assessment, and I'm just going to be inspecting the temporals, palpate the masseter muscles, and now I want you to open your mouth whilst I apply resistance. I'm sure you've done stuff like this before. I'm just going to apply resistance to your jaw whilst you're trying to push it down again, and I'm doing it to the shoulders as well. So I'm just going to sort of apply some resistance here to your jaw, to your jaw, to your jaw. So just try and push down for me. Yeah, I won't push too much, obviously. You know, your jaw is only so strong. Okay, and now the shoulders. So just broaden out your shoulders just a little bit for me. Okay. Yeah. Okay, good. That's really good. Obviously, as you get older, you will get weaker. But realistically, you should still carry those reflexes and muscle reflexes well. So, yeah, we're not going to do that one. I've done this one in the past, and I've been hit in the face for it, so we'll skip that one. Okay. And we'll move on to the facial nerve, which is actually the 777th nerve. And I just want to ask you if you've sensed any change in your taste recently. Yeah, in the last couple of months, perhaps. Any sort of change in taste. So you've been ill a couple of times, but anything out of the normal, really, where it hasn't gone back to normal sort of thing? No? Okay. That's good to hear. Everything sounds good so far. Have you had any sort of hearing changes where, perhaps you used to hear something at a certain level of volume, but it's gone down or it's gone up? It's gone down a little bit. Do you clean your ears? Okay. So that might be just a problem with your eardrum, or perhaps maybe I don't know, just sort of your ear getting older. It happens to the best of us. I just want to check your facial expressions here. And what we do here, I just ask you to do a couple of expressions, and I react to how quickly you do it and how well you do it, of course. So I want you to raise your eyebrows for me. Yeah, just like that. Okay, good. Close your eyes. Okay, firmly. Okay. Blow out your cheeks. Yeah, just like that. Okay. I want you to smile and then pucker your lips for me. Pucker, 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 pucker. Okay. Yeah, I don't think anyone's really had a problem with that one, so that's good. Okay. Now on to the vestibular. I can never say this one. Vestibular something nerve. So, okay. This is going to be focused on your hearing, where I'm going to be whispering around 4 numbers, I'd say, into each one of your ears, So if you just want to repeat those back to me, that would be good, okay? And that would mean that your hearing is here, okay? So I'm just going to start on the right hand side with a 5, 2, 3, 1. Okay, 5, 2, 3, 1. Good. And the other one. 7, 1, 4, 7. 7, 1. Yeah. You're really good at this. Usually this sort of stuff makes me grumpy because cranial nerves exams are the longest exams I do as a doctor, but you're making this really easy for me. Okay. Yeah, we don't need to do that. You've passed that. I think these are the 2 last nerves we will check out. The vagus and the glossopharyngeal gel. ask you if you've experienced any issues with swallowing, and don't take that the wrong way or anything like that. I'm not trying to be inappropriate or anything like that. It's a genuine question, and I will have real concern if you've had any problems swallowing. Okay, you haven't. Okay, that's good. Have you had any changes to your voice or your cough? You get a little bit croaky, just like me. Yeah. Is that just phlegm caught up in the mouth? Okay, you think so? Okay. So I just want you to say "ah" for me, and then I just want you to cough. Yeah, and I'll stay back, because obviously COVID and all that. So just say "ah" for me. Okay, and just cough. Yeah, I'll cover my mouth. Okay. Yeah. Really well done. But now, we're going to move on to the swallow assessment. So I've got some water here. I've got some water. And what I want you to do is just take a sip of this and swallow it. Simple as that, really. So here you are, open wide. Okay, good. Okay, and swallow that for me. Okay, good. Really impressive. Okay, so now we're going to move on to the gag reflex. People always joke about this one, but it's a serious test where I just want to poke my pen as far as it goes until you gag, and we'll see the results. Just because, if you gag too quick, there could be a problem with your reflexes there. So I just want to check it out for you again. So are you ready? Yeah, this will only take about 2 seconds. Okay, so, wow, okay, I think that's about average. I say wow, it was quick, but that's about average, I'd say. The best ones are the people who don't manage to gag very quick. Those are talented people indeed. Okay, so now we have the final nerve assessment, which is the accessory nerve. Okay, so I'm just going to be... Actually, no, there is one more after this. I'm just going to be asking you to raise your shoulders for me, and then turn your head from side to side. Okay, so just raise your shoulders just like this for me. Okay, and then double take. Okay, good. Okay, now we're on to the final nerve. Okay, so we're just moving on to the hypoglossal nerve, and I just want you to open your mouth, and I'm just going to be checking for waste, sort of on the tongue. It can be black or any sort of fasciculations. Okay, so open wide. Okay, do you mind if I just scrape your tongue a little bit with this ruler? Okay. A little bit of black. Just make sure you're brushing your teeth, and you won't have that issue. Okay. A little bit of black. Okay. So finally, I'm just going to place my finger on your cheek, and I want you to push against my finger. Okay, with your cheeks, just puff them out for me. Okay. So I'm just gonna push against them. Okay. And the other one. Good. Really good. I'm really impressed with what you've done. So I just want to go ahead and explain to you that the examination is now finished. I thank you for your time, and I just want to summarise my findings real quick. So let me just write up and get a conclusion. Okay, so just give me 1 second. Okay, so you passed about everything in the examination, except for the gag reflex could be better, but also just make sure you're brushing your tongue quite a little bit more, and